Hello, everybody. I'm back again today. This week it's three lives. So today our topic is persistent pelvic pain with two amazing physiotherapists today. So let me introduce myself first. I'm health and wellness coach or women's health fitness coach and then nutrition counselor. And here is Boutique Pelvic Health joining in. View the request. Go. And I'm the founder of this platform, and you can call me Ange or Anjali. Accept. Okay. Hey, Zara. Hi, Zara. How are you?
Hello.
Welcome.
Thank you for having us.
So nice to have you in this platform and, doing the work you're doing. And I'm just, introducing you. And we're waiting for you. Well, hopefully Renee will be here soon. Yeah. Okay. So today we have Zara, two amazing experienced physiotherapists coming together to enlighten us in persistent pelvic pain topic. Okay. So let me read their amazing bio. So Zara works as a pelvic health physiotherapist at Boutique Pelvic Health and is passionate in supporting women in menstrual, pelvic, and sexual pain. And Renee is an experienced physiotherapist at Future First Physio with a special interest in the management of persistent pain and other chronic health conditions. Thank you everyone for coming. Okay, Pelvic Health has joined in. Maybe I will send a request.
So pelvic health ed, that's going to be Renee.
Yes, but I can't send her request. She will have to send me a request. She's trying to figure it out, I guess. Together, Zara and Renee have developed a holistic program called Nurture for Women, AFAB. So, Zara, if you don't mind, what is the full form of AFAB?
Yeah, thank you. We just want to make sure that all our listeners and I guess everybody in our community knows that our nurture program is inclusive. So we do use the term women,
Yes.
but it is anyone assigned female at birth or essentially anybody who has a vulva. So just want to put a disclaimer out there that although we do use the terminology women in a lot of what we're speaking about and what we'll be speaking about today, that we are very mindful and try to be as inclusive as possible. And of course, we always welcome feedback as well. If there's anything we can do differently or better. So thank you for your patience with us as we navigate this.
No, that's awesome. So, Zara, Renee is saying I can't send the request. So I will say, just look at the bottom of your live page, Zara. Not Zara, Renee. Look at the video logo at the bottom. It's a thank you for being patient with us, everyone. It's our first time, so we're trying to we're guiding and at the same time, looking at the video logo at the bottom of the live page. Thank you everyone for being so patient. Here she is. I got it. Yes, I accepted her. So she must be coming soon. Yes, so here she is. Hello. Hi, Renee. You managed it.
It wouldn't let me on the computer, so I've gone to my phone and on.
Oh, yeah. Well, we always figure it out, right? That's awesome. Yeah. Thank you. So, thank you everyone for coming here today. And, please welcome Zara and Renee. Who are amazing physiotherapists, and today we are talking about the persistent pelvic pain, pelvic health pain, right? What did I say?
Yeah.
Sometimes my English is not the best. I get confused with my own English. Before we start, I just wanted before we start, I just wanted to say this, that this chat talk we are doing is all about to bring awareness, educational and general information. And if anyone, any viewers are having this pelvic pain, pelvic health issues or any concerns, yeah, we would, recommend you go and see your, practitioners instead of, yeah. So, yeah. So if or at the end we will be doing Q&A session with Zara and Renee. So please stay tuned, and you can ask the questions at the end. Or if not, then I'll put all the link details, the contact details, and you can DM them directly. Okay. So should we jump into the question, or would you like to add anything else?
No, let's get started.
All right, let's get in. So how can we define the persistent pelvic pain, and what does it involve?
So persistent pelvic pain's a really broad umbrella term, and really it means kind of any pain that's occurring within the pelvis that's been lasting for more than 3 to 6 months. These include things like endometriosis, which we're obviously hearing so much about at the moment, which is fantastic. We're getting a lot more about it. Adenomyosis, vaginismus, vulvodynia, bladder pain syndrome, the list goes. So it's not just one diagnosis, it's a whole lot of different kind of fit under this term. With this pain, it can be kind of cyclical pain. So people may only experience it, for 2 to 3 days every month, and it can be really debilitating, that pain during that time. Or for some, they might be having this pain more constantly now. And it's also not that we see that the pain can change. Maybe starting off as being that pain, and then over time, and when that occurs, it doesn't necessarily mean the pathologies become worse, but our whole nervous system become more protective and more responsive to what's happening in our body, and we therefore find more pain.
So that's why we have more pain happening, because our nervous system is getting more sensitive towards it. Is that correct?
So if we think of it like an alarm system, it's now just starting to be too responsive. It starts responding and sending pain, this output from our brain that we get, more easily to things which may have been perceived as non-threatening previously. So the system becomes too good, our pain system, if we think of it simply.
Yeah, so I'm just thinking reminded me of the fire alarm. You know how it goes first, like beep, beep, and then the lower the battery it gets, and it gets higher and higher frequency. Oh, yes.
I love it as a good analogy, because we want that to go off when there's fire and smoke. But when we've got persistent, that system now starts going off when there is a change in temperature, or someone kind of walks, start to alarm. So the system kind of becomes too protective and isn't really then functioning how we want it to.
Oh, awesome. That's great to know you, because I'm like, because we are so good at avoiding at the beginning, right? Oh, it's not hurting as much, so yeah, I'll be all right. Yes. Oh, that's so good. Thank you, Renee. And so what's the, jumping into the next one. So how does this type of pelvic pain occurs, and is it possible to fully recover from it?
Yeah. It's quite a question. There's so many factors that occur for why this pain occurs. And to kind of be able to understand it, we need to kind of understand how pain works within our body. So if we kind of take a step back and look at pain, so the definition of pain is that it's an unpleasant sensory and emotional experience that's associated with or resembling that associated with actual or potential damage. So if let's simplify it, what it's really saying is that pain isn't a linear relationship to tissue damage within our body, and pain, it relies on more than just that feedback from a tissue up to our brain. So all pain that we experience within our body is an output from our brain. And so many things which go into a pain experience and why you can have pelvic pain. So we obviously can have some of those kind of pathological drivers, inflammatory changes. We can
Mm-hmm.
see muscle in the pelvic floor, it becomes tight and guarded. We can see hormonal impact influences on pain as well.
Mm-hmm.
But we also know there's a lot of other things which also play a role in that sexual side of pain. So as I said, pain's an output from the brain. So the brain has to determine what's going around us to determine if there's a threat, if we need pain. And for that to happen, it also needs to take in things like our environment, our beliefs, our cultural beliefs can play a
Mm-hmm.
role, how we ought to understand our own bodies, and I suppose how we feel about pelvises and periods
Mm-hmm.
and things like that all have a play. We know trauma, past trauma, and ongoing
Yes.
trauma can have it. So it really takes everything. It's kind of that bias factors. So it's everything that kind of goes pain.
Yeah. Would you like to add anything in it, Zara?
Yeah, I was just going to lead on that it's multifaceted.
Mm-hmm.
So like Renee said, you really don't want to look at just a tissue pathology course.
Yes.
We know that, we are more than just that. There are so many things that are intertwined, and it's really that
Mm-hmm.
holistic approach in management of persistent pelvic pain.
Yes. So
And
it's not, yeah. Sorry, Renee. Go.
sorry, no, like the other part of the question was, can you get rid of it? And
Mm.
you have a degree of pain, but it can definitely be improved to the point that it's not impacting on your quality of life.
Mm.
That you're not as restricted by pain, and you're kind of in control of it a little bit more. And for some people, they find their pain does taper off almost completely.
Mm.
For others, their constant pains now just become more of a cyclical 1 or 2 days,
Mm.
but it's quite manageable. Those same impacts that it was previously.
Okay, awesome.
And to really move through in the best management of the pain, the first thing we need to do is understand what's going on in the body and understand, how pain works. So if you actually don't have those key foundations of not only understanding, okay, I have an endometriosis diagnosis and I've got chronic fatigue and I've got sleep issues, or I've got, all these other things going on. Yes, that's great to understand that we've got these conditions in our body, but we've actually got to understand, well, how does that actually play out? How does pain play out? And what is it specific for me? Because we're all unique as well in what's going on in our body. And we know that the first step for management and moving on into a life of joy and pleasure without this persistent pain holding us back every day, we really need to understand the foundations of pain. And with persistent pelvic pain, so in the pelvic, abdominal, hip region, we really need to connect with that part of our body and understand our body and understand our pelvic anatomy and function and understand how the bladder works and what's normal and how the bowel works and what, what is within the realm of normal, what things we can address. Sexual physiology as well, there's a huge impact with sexual pain as well. Majority of people with persistent pelvic pain do have these alarm bells going on in general for movement and, when they're weeing or when they're having bowel movements, but also that intimacy as well. So actually understanding, sexual physiology and actual pain principles and that biopsychosocial approach and intertwining it all. And I guess for the people listening today, it can feel a little bit overwhelming when we've got this all-encompassing sort of pain that might be there on most days or most days of the month. But if we can understand the key foundations in how pain works and understanding our body and our pelvic region and how it's all interconnected, the management strategies are all sort of overarching as an umbrella. So if you sort of work in one area, you can get flow over into other areas. So although it can feel really sort of overwhelming and feel like there's just so many things and every doctor appointment you go to, there's another thing coming up. If we can go to the key foundations and work out, well, how can we, work on understanding pain? How can we work on management through top-down strategies, bottom-up strategies? So can we look at our sleep? Can we look at our sleep hygiene, improve on that? How does that interplay with our pain? Can we look at our nutrition? Can we look at movement? Can we look at how we can get back into activities that bring us joy? Can we look at rediscovering our pelvis and working out ways where we can, feel intimate, but we actually don't trigger off that flare-up line for our pain? How do we communicate that with our partners? So we've got extra layers there as well with regards to intimacy. But yeah, just for those people listening, you know, we understand it can feel so overwhelming. We know it can feel like so much and so enduring every day. But just giving that hope that, you know, if you work in one area, you do get flow over to the others, but it's understanding that connection, and that's really where you get those bigger changes.
That's amazing. So, pardon my ignorance, but did you mean foundation mean like a causes? What causes the relationship or the sorry, I was trying to understand the when you say foundation, is it means the causes?
Yeah. So when I say foundation, sorry, I'm sort of going back to the way that we treat and how we manage people with persistent pelvic pain. And we know, just for foundation, I'm talking about sort of practice that everybody, you know, if somebody's got persistent pelvic pain or endo or bladder pain syndrome or irritable bowel, it's sort of like, okay, there's sort of key foundations for each person that we kind of want them to understand. And we want them to get some strategies to actually be like, okay, I've got this self-help tool, this management tool that I know I can pull out and we can address it. So just to give you a little bit of an idea, in our Nurture program, which is our program specifically for women with persistent pelvic pain, the first foundation is understanding how pain works. So Renee just gave a beautiful little snippet of some of the key principles of that, and understanding how the nervous system is involved, but also, you know, we've got involvement of the neuroinflammatory immune system as well. So understanding that interconnection. Another foundation is understanding the pelvic body, we say. So this is sort of a bit more of my hat, where I come in as more the pelvic health trained physio. So this is talking about, well, what's going on with the bladder, what's going on with the bowel, what's going on with the pelvic floor muscles. And then we've got connection with other areas of our body too. So there's a big connection with the diaphragm and the respiratory side of things. But then we've got this beautiful other overlap as well, which is another foundation, so another area, which is our nervous system, which we talk a lot about the polyvagal theory and vagus nerve. And we know that there's innervation of that diaphragm through that vagus nerve. But we also know when we're in persistent pain, we often find that we get a little bit stuck in our nervous system state. So actually working on vagal tone, or actually working on that vagus nerve and sort of moving through those different sort of sympathetic, parasympathetic, ventral, dorsal, vagal. So this is all stuff we go through in our program, can actually be a beautiful management tool as well. And then just to give you the last couple as well, pelvic floor muscles have a huge connection with the diaphragm, and they can hold a lot of tension. So actually understanding what's going on in your body. And then we've got that overlap with the whole pelvic region, with the hip and the back as well. And then the intimacy side of things is a whole nother thing too. But what we actually do to manage pain with exercise or movement through graded exposure and pacing, we actually apply that same principles and understanding, okay, well, we know now our pelvic anatomy, we know our genital anatomy, our vulva, we know where the clitoris is, how the clitoral complex works, how arousal and desire works, and we know we need to build in safety to help manage pain and to move into more pleasure. So then we use all the principles we've spoken about in all these other areas of our body, but we talk about graded exposure and pacing for our intimacy, because that's really important to build up safety in self, and actually to move away from pain and move into more pleasure. Because for a lot of people with persistent pelvic pain, they actually shut off from that area of their body. They do a full disconnect because it's associated with pain and danger. And there might have been other things contributing as well, like Renee said previously, with regards to that biopsychosocial approach. So yes, there might be the endometrial lesion, and there might be that local like menstrual bleed, which triggers that inflammation. But then socially, there might be actually, you know, a cultural background, or there might be relationship factors, or self-esteem, and you know, just stigma associated with talking about sexual health as well. And then if we turn to like the psychological side, like trauma is really important. So it's really important for anyone in this space that they are going to people who do have a background and can provide trauma-informed care. And it doesn't have to be just sexual trauma. We know that's a huge element, but we know there's a lot of medical trauma as well. Because although there's all this beautiful movement and shift with endometriosis and it coming in the limelight, which is wonderful for funding and things.
Yes.
We know that it hasn't always been that way. And a lot of people have gone to practitioners and they haven't been heard, they haven't been validated. They've got on a treatment bed. They haven't been given the uttermost respect, care, love, dedication in that area of their body that they have every right to be.
Yes.
And yeah, they've had this medical trauma from this experience of possibly an examination, or even if it didn't go there, just the conversation that's happened itself.
Yeah.
So yeah, there's a lot of things.
Yes,
but,
a lot of things to unpack, but like it's incredible how much things that you eat can the pain is not just a pelvic pain, but related to so many aspects in your body. So you can't just say, oh, I have pelvic pain, so I'm just going to treat that. But that's why we have ladies like you, so who will unpack all these issues and then and be able to move into normal life, I guess, isn't it? Is normal, can I say normal?
Well, I think it's a life that is joyful for them, because they basically shut down all these areas of their life, their work, their relationships, the ability to go out and socialize. So they're living this sort of life that's really sort of compressed. And so it's just opening them back up.
Yeah, awesome. So we will go towards the, as we all talked about, the types of pelvic, how it the pelvic pain occurs, and how can we recover from it. And now, can we talk about the general steps that we can do to assist this condition?
And I think Zara's just touched on a lot of it just then. About aim, you need to have a multidisciplinary team to really help manage this. No longer treated with a very medical model of oral contraceptive kind of pills and surgery. And if they didn't work for you, then women were quite often dismissed or felt really isolated and alone in their management. But we now have specialised persistent centres opening, and it's all multidisciplinary because we need to address all these factors we've just talked about to have success. Just try to treat one area of it, we're probably not going to have long-lasting effects. And you need all those specialists kind of come together. You need a good medical team. Pelvic health therapy, it plays a big role. Dietetics, psychology, therapists, it's going to be really individual. And that's the big thing. It needs to be individualized because everyone, although they may have similar pain experiences, are going to have a journey and then different things to help with that management.
Yeah, I love the fact that it has to be individualized. You can't just give a like a group, okay, this is the this is what you're going to follow and you'll be all right. That's almost like a traditional. In past, I guess we used to have that like set of things, the questions to tick tick tick, and then but then now these days the practitioners are coming to this, that the people has to be individually treated. And I love that, how it is coming in.
And I guess on that note, you mentioned group. So Renee and I do run a group called Nurture, and this group is for women with persisting pelvic pain. So it's designed specifically to go through those key foundations. And what we actually find in clinic is that a lot of women are fearful. A lot of women are fearful to taking that step because they've probably had past experience with other medical professionals, unfortunately, or they're just feeling, it's an intimate part of the body. So it can feel a bit daunting, and they might have been told, okay, well, go see a pelvic health physio, but they're going to get you on that bed and they're going to do an intimate exam and they're going to push you into pain. And, that's all sort of fear-inducing, and it's going to bring on the pain. And I see a lot of women as well work in a chronic pain clinic too, and they don't book in with me one-on-one because they've seen pelvic physio in the past and have had a poor experience, and they're like, nah, I'm not going to go see a pelvic health physio. So what our program does is it's builds in a lot of safety. So you come in circle, because it's quite isolating, this, having this condition and feeling, not you know, alone.
Mm.
So you come in this group with other people going through similar things. So you've got that support just by knowing you're in a room with other people with
Yeah.
similar circumstances. But then we go through all this, and you need to get this education and this understanding.
Yes.
And it's kind of like getting that information, and then you're like, okay, I'm going to pull that out for me. I'm going to pull, oh yeah, that thing is maybe for me, or that's what I'm going to explore. Then sort of at the end of it, it's like, okay, now I've sort of met these physiotherapists, you know, Renee, the pain, who does chronic pain, and Zara, who does pelvic health. And I know that they're really loving and caring and nurturing practitioners, and they're going to honour me. And so they have that confidence then to connect and take that next step. Or it might be at the end of nurture, it might be that we actually go, well, you know, there's a lot going on. Let's direct you to a psychologist who's specifically trained in sexual pain or persistent pain. Let's give you that support. Or let's, you know, you've got your IBS and you haven't had dietetic involvement. So let's send you to Shani. We know that she's doing her endo PhD. She's brilliant. Let's send her there. So we're kind of making this collective. But I think although individualized care is a must and we always want them to get there, a lot of women can't get there right at the start, and that's where our program is really powerful, and they get some really good results even without taking those steps. So they've actually got something. They're not just alone.
Absolutely. I love how you you know, you are educating people, not just giving the treatment, but educating them, and you know, and starting with the group and making them feel comfortable and feel loved and heard, and not just forcing it in. And that is and you're working together, right? You support, you, if the person needs someone else, you're guiding them towards another person, and it just all working together. It's like you said, it sounds like really beautiful, you know, loving, nurturing program, and I absolutely love it. And you know, I would love
lights us up.
keep
We
talking.
like have so much joy. Like it's we love our work.
No.
We're so passionate about our work, but when we get like together, it just like literally lights us up so much.
We can hear and see. Thank you so much for coming here. I love it. And so as much as I would love to keep talking about it, we are coming to the end. You know, slowly we are starting to wrap up. So we're going to ask our viewers if they have any questions. You know, please comment down below. And while we're doing that, please, Zara and Renee, let us know about, you know, where we can find you, or the people, if they want to reach out to you, you know, where can we find you?
So we actually have our next nurture program starting next weekend. It's on the 8th and 9th of June. So it's not too late if you are joining in. Contact with us either through the Health Ed or through Boutique Health. Through you with that. I also work for my own company. It's called Future Physiotherapy, and I specialize in persistent pain and other chronic as well, if there's anything there where you would like further assistance with.
And Zara, where can we find you?
Thank you. I'm in Bundall, so I'm on if people are local to the Gold Coast, if you're on Bundall Road and you're heading down, you see the big blue 40 wings on the opposite side next to the park. There's a building called Boutique. So I'm tucked in there. This is my clinic.
Okay.
So I'm at Boutique Pelvic Health Physiotherapy. I love what I do. I work in everything pelvic health. I love all the peri-postmenopausal stuff too. Sexual pain, persisting pelvic pain, and love all the pregnancy, postnatal, and nourishing our mamas. Very close to my heart. I'm here.
And you are very popular in our platform, so you know everyone will be chuffed to see you today. And you know, and thank you, Renee, for joining in and even making it, you know, like more the merrier, right? And we all coming here together to spread the message that this is possible, that you know, we don't have to live in persistent pain, and finding out what it is causing, and you know, how you can seek out for help, right? So yeah, and so if anyone would like to send any messages or any questions, please directly message Zara or Renee, and I'll put all the links down in my content. And yeah, ladies, thank you so much for coming here today. And it's you know, the day is beautiful, and you know, and even made it better that I get to talk to you in person. Thank you so much.
Thanks so
Yeah.
much for having
Thank you,
Lovely connecting.
everyone.
Thank you for having
Yes,
us.
likewise.
me.
Thank you, everyone, for coming here.
Bye.
Bye.